Hi, today we are going to start the diseases of conjunctiva from Parsons. Let's start with the anatomy and physiology of the conjunctiva. The conjunctiva is a thin mucous membrane lining the surface of the eye and eyelids. It is divided into palpebral and bulbar conjunctiva, and the fold or the cul-de-sacs which unite these two parts of the conjunctiva, that is the palpebral and bulbar, are the fornices. So if we see in this, the dotted area is the dotted area is the eyelids. Inside the eyelids is the palpebral conjunctiva. Okay, on the surface of the eye, that is over the sclera, is the bulbar conjunctiva, and this is the part which unites the two, that is the fornix. So basically here we remember that there are two parts, palpebral and bulbar. You can also say that the fornicial conjunctiva is there, which is the uniting part. The palpebral conjunctiva is firmly adherent to the tarsus, and the bulbar portion is freely movable over the sclera. Palpebral conjunctiva is firmly adherent to the tarsus, while the bulbar portion is freely movable, okay, except at the close to the cornea, where it is attached to the cornea at the limbus. Okay. Histology, we will see the layers of the conjunctiva. First is the epithelium, the outermost layer. The palpebral conjunctiva is said to commence at the anterior margin of the edge of the lid, but from this point of the posterior margin of the edge to the posterior margin of the edge, that is the marginal strip what we call, and for about 2 mm beyond to the sulcus subtarsalis, there is a transitional zone covered with stratified epithelium with the characteristics of skin and conjunctiva. Okay. So on the intermarginal strip and 2 mm beyond, okay, we have the stratified epithelium which has the characteristics of both skin and conjunctiva. There are two layers of epithelium over the palpebral conjunctiva, two layers of epithelium on the palpebral conjunctiva. The epithelium becomes gradually thicker from the fornices to the limbus, forming a stratified, non-keratinized epithelium near the corneal margin. So we have to remember these words. Basically, at the margin of the lid, what you see is stratified epithelium, okay, which has the characteristics of skin and conjunctiva, and there are two layers of epithelium over the palpebral conjunctiva. Then as you go from the fornices to the limbus, the number of layers or the epithelium basically goes on thickening, forming stratified means layered. So stratified non-keratinized epithelium near the corneal margin. The rest of the palpebral conjunctiva lining the lids consists of thinner non-keratinized epithelium. So basically the whole of the epithelium is non-keratinized epithelium. Keratinized epithelium is seen in the skin, okay, and conjunctiva is a mucous membrane, so it is a non-keratinized epithelium. Then second is the adenoid layer, which lies below the epithelium, consisting of loose connective tissue containing leukocytes, adenoid layer. Third is the dense fibrous layer, which passes insensibly into the underlying tissues, that is lid or sclera. Okay. Then we come to the blood supply. The blood supply of the conjunctiva is from the marginal arcade of the eyelid for the marginal conjunctiva, the peripheral arcade of the eyelid for the fornicial conjunctiva, posterior conjunctival artery, a branch of peripheral arcade to within 4 mm of the limbus, anterior conjunctival artery, which is a branch of the anterior ciliary for the limbus, and capillary arcades extending 1 mm into the cornea. So, the marginal arcade of the eyelid for the marginal conjunctiva. The peripheral arcade of the eyelid supplies the phoneal conjunctiva. Posterior conjunctival artery, which is a branch of the peripheral arcade, is up to the 4 mm of the limbus. Anterior conjunctival artery, which is a branch of anterior ciliary, is near the at 4 mm for the limbus. The rest of the 4 mm near the limbus. The capillary arcades extending 1 mm into the cornea. Next we come to lymphatics. The lymphatic drainage is to the submandibular nodes, which drain the medial 1/3 of the superior conjunctiva. Okay, to submandibular nodes, and to the medial 2/3 of the inferior conjunctiva. So basically it is the submandibular nodes for the medial 1/3 of the superior and medial 2/3 of the inferior conjunctiva, and lateral will go to the periocular nodes, okay, which is the lateral 2/3, that is the rest, lateral 2/3 of the superior and lateral 1/3 of the inferior conjunctiva. Nerve supply. The nerve supply consists of branches of ophthalmic division and branches of maxillary division of the 5th cranial nerve. Okay, 5th cranial nerve, that is the trigeminal nerve. Okay. Functions of the conjunctiva, this is a question. Tear production, so it forms some parts, that is the mucin by the goblet cells and aqueous by the accessory lacrimal glands. So tear production, it contributes to the mucin. Supply of oxygen directly to the cornea when the eyes are open. Okay. Wash off debris. Maintain smooth surface. The ocular surface has to be smooth to for the person to feel comfortable. Protection of the eye by defense mechanisms, which include non-specific measures such as presence of an intact epithelial barrier, lacrimation, provision of rich blood supply, and mucin clumping, and specific immunologic mechanisms such as outpouring of mast cells, leukocytes, presence of an active mucosal associated lymphoid tissue, that is the malt tissue, and antibodies in the form of IgA, secretory IgA. Now, the conjunctival surface is lubricated by the tear film, which is a triple layered sandwich. Now, see the layers of the tear film. Innermost is the mucinous layer, which is received from the goblet cells. So, innermost is the mucinous layer lining the conjunctival cells and the corneal epithelium, secreted by the goblet cells, crypts of Henle, which are infoldings of conjunctiva, and glands of Mans, which are located in a ring around the margin of the cornea. Then middle is the aqueous layer, which is secreted directly by the lacrimal and the accessory conjunctival glands of Krauser, found along both the inferior and superior fornices of the conjunctival sac, and Wolfring and Ciaccio, the glands of Wolfring, which are small tubular glands located near the upper tarsal border in the upper eyelid. Outermost superficial lipid layer. Okay, so first was the mucinous layer, second is the aqueous layer, and the outermost layer is the lipid layer secreted by the meibomian glands, which are vertically oriented sebaceous glands. These are sebaceous, meibomian glands are sebaceous glands. This is an MCQ question. Found within the tarsal plate and open along the eyelid margins and limits the evaporation of tears. Okay. Coming to the microbiology, the conjunctival sac is never free from organisms, but because of its low temperature, evaporation of lacrimal fluid, and moderate blood supply, bacteria do not propagate themselves. Moreover, the tears are not a good culture medium, and although they contain a bacteriostatic enzyme which is called as lysozyme, they cannot be regarded as actively antimicrobial. Hence, they act principally in a mechanical manner, washing away deleterious agents and their products. However, bandaging the eye arrests the movement of lids and raises the temperature of the sac, thereby increasing the bacterial content of the conjunctival sac. Most of the organisms normally present are non-pathogenic commensals. So, we should remember what are the commensals present in the conjunctival sac. They are Staphylococcus albus or epidermidis, diphtheroids, Propionibacterium acnes, Neisseria cataralis, and Cornybacterium xerosis, and there are many others. But some of them are morphologically identical with pathogenic types. Diplococci indistinguishable with pathogenic Diplococci indistinguishable from pneumococci are sometimes present. Cornybacterium xerosis is identical with C. diphtheria and is frequently present in the normal conjunctival sac. They can only be distinguished by cultures. Okay. Cornybacterium xerosis is indistinguishable from C. diphtheria and they can be present in the normal conjunctival sac. Staphylococci are often found and are relatively innocuous in the absence of other organisms but play an important role in mixed infections. Okay. Streptococci, E. coli, B. proteus, that is Bacillus proteus, Neisseria gonorrhoeae, Haemophilus aegyptus, Moraxella, etc. are pathogenic and are rarely found in normal eyes. These are all culprits for infections. Streptococcus pneumoniae, Neisseria gonorrhoeae and Pseudomonas pyocyanea are amongst the most dangerous in ocular infections. Streptococcus pneumoniae and gonorrhoeae and Pseudomonas pyocyanea are most dangerous. Viruses as well as chlamydia also play a large part in conjunctival disease. The common viruses are herpes virus and adenovirus. So, this was all about the introduction of conjunctiva, its anatomy, functions and microbiology. We will continue the rest of the chapter in the next part.